So today I'm here with Briony at 13th Retail Services. I'm going to ask her a few questions about pelvic floor, especially things that you guys had concerns of at home, how to do particular exercises, and we'll go through a few of the other common questions. So let's get started.
So one of the things that's really important when you're pregnant is your pelvic floor. So a lot of people think that if they don't have a natural delivery, that then there's no trauma to the pelvic floor, and so that they don't have to worry about the same things. But that's actually not the case, because for that whole 9 months that you're carrying and growing your baby, you've got pressure on your pelvic floor. So regardless of what type of birth you have, there is still going to be a level of trauma to the pelvic floor. So it's really important that throughout your pregnancy and after your pregnancy, certainly after speaking with your obstetrician and when's the appropriate time, to be doing some pelvic floor exercises. That's something that's a really common question.
Okay, perfect. How to know that I'm activating it would be a really good one to start with.
Yep, cool. So there are specialist physios, women's health physios, that can do internal exams. Certainly you've got some specific issues, I would highly recommend going to see a specific women's health physio. But most physios can just do a general examination, which is what we can do today. There's nothing invasive about it, and it's something you can do at home, and people can do at home just to see how they're going with activating. So I would first get you just to bend your knees. Yep, that's it. So we obviously can't see the pelvic floor in this position, but we can see and feel some of the muscles that work with the pelvic floor.
Yeah.
So they run along across your lower tummy. So we'll just call them your core muscles for now. It's a bit of a generic term, but we'll just call them that. So if you find your hip bone, so I'll feel on this side and you can do it on the other side if you want. So you want to find the front of your hip bone where it sort of sticks out there.
Yeah.
Obviously, the more pregnant you are, the harder that's going to be to feel. And then just come in off that, so you're not on the bone anymore, you're on the soft skin on the inside.
Yeah.
It's probably about a finger width, maybe 1.5. And what I want you to do is do what you think would be turning on your pelvic floor for me now. So what we're feeling for is feeling the muscles under your fingers starting to work. So I'll get you to relax again, okay? And then do what you would think was turning on your pelvic floor. Good. And relax. So what I'm feeling there is a little bit of tension underneath my fingers. Can you feel that on that side? So in someone who's not sure if they're activating the pelvic floor, this is a way to check. So do what you think is using your pelvic floor and see if you can feel anything happening there.
Yeah.
For someone who does that and they don't think they can feel it and they think they're not actually activating it, using simple cues is a really helpful thing that we use. So some really obvious and common ones are people talk about like going to the toilet and trying to stop midstream, which I definitely advise. You can practice doing that, but don't do it every time you go to the toilet because you'll end up with other issues. So just do it as a test run.
Yes.
So you're pulling up through your pelvic floor when you're midway going through the toilet, and that helps to engage it. So if you practice that movement and think about that cue, try that for me now. Good. And relax. Good.
Yeah, I could feel that.
Feel that a bit better this time. Other ones that work for people is just thinking about lifting up through the bottom of your pelvis.
Yeah.
I've heard of some that's a reverse drop of water.
Okay.
So think about your pelvic floor as being like a drop of water coming down, but you want to do that in reverse.
Okay.
Just anything that helps to give you that visual picture,
Yeah.
and then feeling in that spot to feel if it's working. And then obviously if you're still not sure, seeing a physio and just getting them to go through it with you, and
that clarity just gives you that peace of mind that you're doing the right thing.
Yep, absolutely.
So the next question I have is just simple exercises that people can do at home or if they're in the car, and how often they should do them as well to help strengthen their pelvic floor.
Yep, sure. So very good question. So there's a couple of things that we'll do. There's 2 types of exercises. So the first thing is obviously what we just went through, knowing how to activate it.
Yeah.
Once you can do that, you can start to add in some holds. So if you feel comfortable and you want to feel through there when you're doing it to make sure you're doing it right, you can.
Yeah.
Otherwise, you can just lie relaxed in this position.
Yeah.
Just make sure that your knees aren't clenched. You just sort of want to have your knees about hip width apart. Yep.
Okay.
So what we do is you would turn on your pelvic floor like we just talked about, and then you would hold it. Some people will be able to hold it for 5-10 seconds, maybe more. Others might find they do 3 and then they start to really struggle. So you would just hold it for as long as you can and then relax. Yep. And go again. Good. And yeah, so just holding there, probably up to about 10 seconds, I would say is enough. I wouldn't get people doing more than that.
Yeah.
It is really important though that you relax after each hold. So it's just as important to have an active pelvic floor, but you also don't want to have an overactive pelvic floor. That can actually lead to some other issues that are often harder to treat. So it's really, really important, and if you are doing it at home, make sure that after every contraction you properly relax your pelvic floor and you're not holding on to tension, because as I said, that can cause issues, especially with pain for people. So we do that, and I'd probably get someone to do 10, so if they're doing 5-second holds, 10 5-second holds.
Yeah.
At the end, I then get them to do 10 quick hard pulses.
Okay.
So what the purpose of that is that there are times when maybe you'll cough, you'll sneeze, you'll be in a situation where you really need to strongly engage your pelvic floor. It's not about holding it for a long time, but it's just a quick, I need it to work and I need it to work now.
Yes.
Often exercise related.
Mm-hmm.
So doing those quick hard pulses where it's like a maximal contraction practices that more strength aspect as opposed to the endurance. So the first one was just a nice gentle contraction. We weren't seeing any bracing through your tummy or anything.
Yeah.
This time when you do it, I just want you to just turn on your pelvic floor quickly and hard. Yep, good. And then just relax after each one. Yep, good. You'll see there's a lot more happening there in your tummy, and that's okay. In those instances, you are going to use a lot of other muscles as well.
Yeah.
So that's why it's a different type of exercise.
Okay.
So you do 10 of those at the end, and I'd probably get someone to do that at least 3 times a day.
Yeah.
Some people find they like, you mentioned in the car, some people like something to remind them, and I'm not sure where the car thing came from, but the traffic lights was always the example when you're stuck at the traffic lights to do it. But you can structure it around your day however you like. You could do it with every meal. You do it before you have your meal. If you're a busy person at a desk and you do a lot of emails, every time you get an email, you do some. And although that dosage of 10 lots of 5-second holds and then 10 pulses, even if you do a little bit here and a little bit there, it's going to be better than nothing. Yeah. So use the dosage as a guide, but anything you do is going to be helpful.
How do you know when you have an overactive pelvic floor, like you were just saying?
Yep. So it is something I think it's more common than people realise.
Yeah.
Often it's in younger, more athletic females. So usually it's a lot of pain in the pelvic floor, pain when using the toilet, can be pain with sex, it can be anything to do with an experience of pain, and so that high tone gives you that pain. So it's usually something they don't realise is the issue, and if anything they might have seen someone and they've said to them, oh, you know, you've got a problem with your pelvic floor, do pelvic floor exercises. So it's definitely something I would recommend people either speak to their GP or speak to their physio, and if it's a general physio, you know, like myself, I would probably refer them on to someone who's going to be a specialist for women's health. Or they might be referred there straight away from their GP. But yeah, that's probably the main symptoms that you want to look out for.
All right, I do have one more question. Now that we talked about an overactive pelvic floor, what about one that isn't working, like it's very weak? So what are the signs and dangers?
So probably the most common sign or symptom will be some incontinence, and it's usually just a bit of leakage, and very common obviously in pregnancy with that extra pressure and just your general deconditioning, things are changing, but you don't have to be pregnant to have those symptoms. So that's definitely one. Pain around your pelvis, your lower back, your sacroiliac joints, which are at the back, that can be a sign. Pain around the front through your pubic bone, just a feeling of instability too, but generally it'll be more of that incontinence that people will start to notice. It's really important to know too that that's not normal. I think there's a lot in the media and advertising that there's an ad campaign about leakage, it's just a little bit of leakage, that's normal, but really that's not, and that's when you can seek help, and it's something that you should seek help for because it can have a big impact on your life. And if there's little things that can be done for that, I think it's really important that people know that there's definitely help for that.
Okay. Wonderful. Well, thank you so much, Briony,
for joining
and letting us know all about pelvic floor. That's going to really help others. And if you want to book in an appointment with Briony, then come down to 13th Beach Health Services.